What's up, everyone? This is Dr. Charlie Johnson. I know I have some crazy glasses. I'm going to explain why I had them on in a minute. Actually, it's kind of hard to see the camera here. But last time we talked about how I was going to do a 30-day basically live series. We're 3 times a week, Monday, Wednesday, Friday at 12:15 sharp. I think maybe I'm a minute late, sorry. I'm going to talk about various things related to pain and specifically lower back pain, sciatica, and things like that. So remember in the last video, we talked about the first mistake that people make with back pain, right? And or again, any pain in general, and that is that they ignore it. Right? And we talked about how just by tuning into this series, you're not ignoring it anymore, right? So what is the opposite of ignoring something, right? It would be basically you go buck wild over it. You go crazy, right? So what do these glasses, these goofy glasses here, have to do with going crazy and trying to go down the path of doing everything you possibly can to treat your back pain and or, again, whatever pain it is that you may be feeling. So, right, if you're ignoring it, there's a bell curve, right? You're kind of living on this end. You're not doing anything about it. The opposite extreme is that you're doing everything about it. Now, that's a mistake, all right? So, we'll just say doing everything is the number 2 mistake, or the second biggest mistake that people in pain make, okay? And I'm going to draw it out here, and here's what happens, right? So you've been doing nothing, you've been ignoring it, and then you're like, you know what, I'm fed up with this, right? So you want to start doing things about it. So you say, screw it, I'm going to do everything possible to try to solve this problem. Well, the one thing you do, right, is maybe you just ask friends, or you go to YouTube, right? You start doing all these exercises, right? Or you go to the your primary care physician, right? And your primary care physician says, just rest, just wait it out. Take this Flexeril, this muscle relaxant, and then take this pain pill or take this anti-inflammatory, right? And they give you like 5 different things to do, or they send you to, so this is like rest, maybe some meds. They send you to a specialist, right? So maybe they send you to the orthopedic physician or something like that. And or maybe they send you to PT or what the heck, chiro, right? The point is that the possibilities are endless. So they give you a bunch of things, right? And then from there you go home, maybe you research, you look up something on Google, or you say screw it, and you go out on your own. So then you kind of go back to like, well, you know what? I didn't like that whole doctor experience so much, so I'm going to go on YouTube. I'm going to ask Dr. Google, right? And you start doing all these things, right? And eventually, if you're looking for natural relief, maybe you've even avoided this step altogether, and you've started with your own self-treatment and or things like massage therapy, yoga, because yoga is the cure for everything nowadays, and or you've gone maybe to see a personal trainer, a PT, a chiropractor, an acupuncturist, somebody who does Reiki, whatever it is. There's tons of people out there, right, who basically, say that they're suited to provide you with alternatives to things like pain pills, injections, or surgery, right? And it's all well and good, but here's what happens when you do everything. So, I gotta erase this for a second. When you do everything, you go down what we call the healthcare rabbit hole. Okay, I call that the healthcare rabbit hole. It's based this idea, right, that you're walking along one day, you have an ache or pain, you're no longer ignoring it, right? And there's this hole. Or maybe there's a tree over here, or whatever, there's some clouds up here, there's a bird, okay? And here's a sun. And you're walking along, and you have back pain, or you get shoulder pain, or you get something, and you decide to go see, maybe again, your primary care physician. And they send you to see the massage therapist. And the massage therapist tells you have one thing. And then you go on and you go to see the chiropractor, and maybe you're seeing them both at the same time. Oh, but then your PT says, no, you're super weak, you're whatever, right? And the point is that at the end of the day, right, all these people have specific opinions about what's going on. So you just dig yourself further and further into the hole. And rather than having all your questions answered, you come out actually more confused. And you're sort of in this vicious cycle of now you've got 30 different opinions about what could be going on. And if anything, you're probably more depressed. Maybe you're in more pain. You're more frightened or fearful, right? So the cloud is just billowing. It's now like what they call like a thunderhead, right? There's going to be a tornado that's going to hit any moment, because you've got all of this knowledge and understanding, and a lot of it probably misinformation, and you've looked up things for now weeks, months that you've been going through this process, and you have x-rays, MRIs, maybe they're supportive, maybe they're kind of contradictory to what you've been told is going on. One person's telling you it matters, the other person is telling you not. You're just like sitting in the corner, right, when you go home, just with your hand over your eyeballs or your hands over your ears, and you just want to scream because you're getting deeper and deeper into this hole, and it's really hard to get on out, all right? So this is why doing everything, living on the one extreme of doing everything is not, doesn't get you much further than just ignoring it. You have to find a happy medium, because here's what happens. So here's where the glasses play in. So what does a bunch of funky glasses, right, have to do with doing everything? So what you have to understand, and this is why it's important in this 30-day live series to do this now versus at the end, all right? Because maybe this is you, and I just ask you, comment below, and you just say yes if you've gone down the healthcare rabbit hole, right, where you've been provided 50 different opinions about what's been going on, right? Here's what happens. Here's what you have to recognize before you see anybody for your pain or problem. So again, you have a starting point, right? Here you are, you're ready to do everything. You're ready to get back to normal, right? Well, what you do is, let's just say you start this. So you go and you see the massage therapist. Nothing against massage therapists, but they're wearing certain glasses, right? So what do they tell you is wrong? In most cases, right, and in my experience, what they might say is, wow, you're just like, you have knots. You're so tight, right? So all of a sudden you go to the massage therapist, and now knots or trigger points are maybe the reason for your pain or your problem, right? So it's a problem within the skin or the muscles or the soft tissue, we'll call it, all right? Well, then maybe, you get temporary relief, but that's not doing so much. So then you say, well, I want to do everything, right? So I'm going to go to the next person. So you go to the chiropractor. Chiro for short, right? And again, nothing against chiropractor, but in many cases, right, they wear their glasses, right? And their glasses, the massage therapist has glasses on that sees everything as kind of orangey. You ever wear like two different glasses, right? And like you're on the beach and you're like, oh my gosh, like everything looks so like blue, or everything looks so like sunny, right? Or bright. And then you put on other glasses, like everything's very dark, or just like maybe a different shade. Maybe it's like pinkish or bluish or greenish or something. Same idea. So get that this massage therapist has on these glasses. The chiropractor, right, they see everything through a certain lens. So then you go there, and it's because you're out of alignment. So all of a sudden you have subluxations, or, I don't know. Yeah, you're out of alignment, subluxations, you need, therefore, an adjustment. So notice how what that person believes is the problem, and what their training and their bias and their glasses kind of show them, right, is exactly how they treat it. So if it's a problem with the joints or you're out of alignment, right, then you're going to likely get some type of hands-on technique or adjustment to correct that, right, so to speak. If you have knots, well, what happens? The massage therapist goes pushing on everything, right? And then chiro, temporary relief. I feel good when I leave there. It's kind of like an immediate high, and then you leave, and you're kind of like, well, I'm no further along here, right? And maybe it works and maybe it doesn't, all right? And that's not the point. The point is that, get this. So then you go and you're like, screw it. There's a 7-for-7 deal at the yoga place, and I was doing some stuff, and I told the yoga instructor that my back was bothering me, or whatever it was bothering me, and she said, you know what? You're just really tight, and you have to stretch it out. And you go, okay, I think that's it. I'm going to try this. It's just because I'm tight, right? And I just need to stretch it out. So then you go to yoga, and you do that for weeks and weeks, and, like, you've just been told to stretch it out, but, like, you can't get any closer to touching your toes, right? So then you're like, what the heck's going on, right? So they have a certain lens because that's their training, right? So they have a different color glasses. And then their solution, obviously, is stretch. So then you're doing yoga. Then you go to PT, right? And the PT says, you're weak, right? Because they see everything maybe as like a muscle problem or an exercise as a solution, right? Again, none of these are right or wrong per se. It's just that these people are living on the extremes and they're wearing certain glasses, and you have to understand that going in, right? Let's see, acupuncturist. That's a trigger point. These people are now treating your thumb for a headache that you have or something like that, right? And they're telling you that's the solution. And what else could you do? Let's see. Massage, chiro, yoga, PT, acupuncture. Oh, and then, you go to see the surgeon. Well, the surgeon is trained to determine whether or not you need surgery, all right? So people say, should I go see the surgeon? Well, while there are some cases when you might need to go see that surgeon, understand that they are wearing certain goggles, right? They are trained and get paid to do surgery. So then you go to the surgeon and, none of this stuff will work, or it's not so likely it'll help you. Instead, what you need is surgery. So, yeah, if you want surgery, you go see a surgeon. If you want deep tissue massage, you go to see a massage therapist. If you want an adjustment, more than likely you will go see either a PT, an osteopathic physician, or a chiropractor, all right? If you think that stretching is the solution, then you might go see a yoga instructor or go to a yoga class, right? But the point is that all these people, right, wear certain glasses and they're sort of standing this close to the tree, right? And what they're trying to do, right, is that they're trying to sort of fit you into a box that fits with what they know and what they understand, instead of trying to determine what box might fit you best, right? So, get this, ready? So, again, if you've been down this before, just comment, yes, been down this road. Cool. All right, so now get this, ready? So all those people have certain glasses, right? What is this? I'm going to do my best. Okay, that's a hammer. So all of these people have hammers. One's a shiny hammer, one's a blue hammer, right? They're all wearing different glasses and they have different hammers. What's this? Okay, it's a nail. I know, there's all kinds of nails too, right? But the point is if the only tool that somebody has is a hammer, everything is seen as a nail, right? So that's why, like, when you're going to see someone, right, just expect that that person is going to give you information and feed you thoughts, beliefs, and, sort of their own little twist on things that fits within their own little bubble, right? That makes sense, such that, oh yeah, I think I can hit that with my hammer, right? So they're going to automatically have that bias, and you have to be aware of that, and you can't be surprised when you come home from the chiropractor and they tell you that you have subluxations in your neck that are causing your foot problem, or your foot problem is causing your back problem. And while that may or may not be true, just don't be surprised by that. And don't hold on to it as the golden nugget, the rule, the reason why you have a specific problem. In fact, right, so these people then go and they do this. So they have a certain hammer, right? This is like the ultimate. I should do another video on this. This is like the ultimate healing equation. Ready? It's going to like blow your mind. Okay, I'll be the first one to say that like I'm terrible at math, all right? Like suck at math, all right? I don't even know, like you could probably put a couple variables in here. I wouldn't even be able to solve it, all right? My wife helped me get through algebra and things like that. So whatever, I get basic math, but this is a little much. But if I can get this, you can get this. So A plus B equals C, all right? So when you have any problem, this is how you heal, right? And understand that this is what is happening when you get treatment, all right? So boil it down and make it super simple and super systematic such that you can find what's best for you to heal, all right? So A is your current situation. That's where you are now. So that's like if you were going to the airport or the mall, it'd be like the X, like you are here, all right? C is your desired situation. So you're like here, and then like Macy's is over there, right? So you're like, okay, I gotta go there. So you're looking for like the bridge or the path that takes you there, right? Well, B is the bridge, right? So we know A. Plug in whatever number or whatever variable you want there, all right? We know C. So let's just say A is a triangle. Kind of looks like a triangle, right? Let's just say C, we'll make that a triangle too, right? Or actually, it has to be different, all right? Because you want to go somewhere else. It's a circle, what the heck, all right? Now, B is like the bridge that gets you there, right? So here you are, here's a post. That's A, you're standing on this post. Your current situation. I have back pain, I have neck pain, I have shoulder pain. I want to lose weight, whatever it is in life, all right? And then you've got C. It's like jumping to the other side of the Grand Canyon here, right? You want to be, here's like your body like in future form, that's a dotted U, all right? You want to be there, you want to get there. So then there's this bridge, right? And this is what you have to solve, right? You're like wondering like, well, how do I get across there, right? This is how do I get to Macy's? How do I get to the other side of Grand Canyon? How do I get to feeling better and getting back to normal with less discomfort, less weight on my body, whatever it is, okay? Back to running, whatever. Right, so B is the bridge, and you have to solve that. So now, understand that, again, you go to whoever, and they're all wearing their glasses. This is how it all fits together, right? They're wearing their glasses. So they've got glasses over here, right? And then they've got a hammer. They all got their own hammer the way they see things. And they're trying to fit you into that little box, that little hammer, because everything looks like a nail, right? So for the chiropractor, this might look like a subluxation or you're out of alignment, right? So they're going to fix that through some type of adjustment, manipulation, whatever. In most cases, a PT might tell you one leg's longer than the other or try to treat you by strengthening you, right? Again, not right nor wrong, but the point is that get that this person, right, like tries to fit you into a certain box, and maybe that person, their variable is like, well, I have this one tool, right? So I'm going to put, this is my hammer. This is a chiropractor putting in there. I'm going to put my hammer. This is a blue hammer, let's just say. I don't actually have blue, but they're going to put their type of hammer into the equation, and they're going to try to jam it in there, right? And they're going to just hope that it works. And hopefully it does, hopefully it doesn't, and maybe you think it does or you think it doesn't, but again, it doesn't really matter. The point is they're trying to plug it in, and then they're getting some result from that. So they're plugging in these certain variables, and within those variables, they're trying to determine, does it get you to where you want or does it not? Is the bridge broken or is it all intact, right? So now, with that being said, the massage therapist puts in, a different thing, and the acupuncturist puts in a different thing, but they're all putting in their own things. Now, let me ask you this. Here's what's happening, right? Hopefully that makes sense. You need to solve that equation. So I'll just write it up here so you get it. That's the equation, right, we're dealing with. Now what happens is, here's a sun. Sun. And this is equivalent to a big ball of energy. I think that makes sense, right? So what happens is, when you start out and you go to see the chiropractor, right, and then you go to yoga, and then you go to PT, and the PT gives you 15 different exercises to do, or the massage therapist tells you this is the problem, and then you're taking medication or you're getting injections or whatever, right? Understand that's 5 different rays or different things that you're doing. Make sense? Now, that's energy. The issue with this is that, let's just assume that each of these is 2 inches long. 1, 2, 3, 4, 5. So there's 5 rays, there's 2 inches long. If I can do my basic math, that's 10 inches, right? So the problem with this, right, is that your energy is so thinly divided, right, that you can't get very far. Imagine if, rather than doing everything, this goes back to the big mistake, right, doing everything, living on that extreme. Imagine if rather than doing everything, you could 2, 4, 6, 8, 10. I don't know, pull the ruler out, right? So this is 10 inches. And this is 2, 2, 2, 2. Right? You can see that you could get a whole heck of a lot further, right? If you would just go one direction. If you would just pick a path, plug it in, right? Maybe this is chiropractor, right? Plug it in and just see what the outcome is. Now, the issue with just plugging in people who are wearing these glasses is that they're always just going to plug in the same variable. But what if you could actually go see someone who could see the forest from the trees, right? So they weren't just standing here in front of the tree. They could actually zoom out. And they had a broad enough sort of knowledge and skill set to actually say, you know what? I'm not exactly sure what this is, but we're going to experiment with movement, and we're going to teach you to experiment with movement such that when you plug in a certain variable, right, you ask yourself, well, what's the outcome? And I'm going to empower you to actually go through the systematic process of putting in and trying different things here. Okay, systematically trying. This isn't just like, hey, try any random thing. This is, look, try something and see what happens. It doesn't have to be any more complicated than that, right? I mean, there's some thought that goes behind it, but the point is that you have to be the one in conjunction with the practitioner, right, or the healthcare person that you're seeing, whoever that may be, to troubleshoot, not someone who's going to fix you by hitting you with their hammer. Somebody who can step back and say, look, I've got a bunch of hammers here, but why don't I give you the hammer and let you see what happens, right? So you want to find someone who's empowering you, who can step back, see the big picture, to experiment with movement, because we know that movement is medicine, and in most cases we can heal many things without the use of these pills and surgery and things like that. Not in all cases, but the point is, no matter what you're getting done, you have to have somebody who can step back, empower you to take control, gives you the hammer, right, such that you can try certain things. You can say, hey, I plugged in B, and then look, was I sane? Was I better? Or was I worse? Right, so even within all of this, there's a simple method to say, look, you know, my back hurts when I, like, bend backwards. Well, what happens if you bend forwards, like, 10 times instead of just, like, going backwards? Because, you know, or, hey, I went to the chiropractor and they told me just, like, keep, like, twisting and cracking my back, or that's what they kept doing. Well, like, what if you didn't do that? What if you did the opposite of what they said? And it's like, well, they told me not to do that. They told me I couldn't strengthen. It's like, there's no golden rule here. I mean, it's quite possible the person who says, hey, look, we're not exactly sure what's going on here, and here's your own hammer such that you can take care of your own self, is actually the person that you want to see, all right? Because they're being the most upfront and they're being the most honest, because we know that a lot of these other treatments really don't have much support for them, and rather than people being open about that, a lot of times we just have an ego as healthcare providers and say, no, this is the answer, I know this will work, and that's not always true, right? So the point is that the worst that happens is that you do something and it makes you feel a little bit worse, all right? Or it makes you feel the same. I'm going to go more into this. I think I'll have to now that I brought it up. But if you do a certain motion, right, and let's just say your back hurts, and it hurts when you, like, bend backwards or when you're standing or something like that, and then you, like, touch your toes for, like, 10 or 15 times, and you can walk further and you feel better, well, like, who really cares what's going on? That movement is your medicine. You plugged into a certain movement into that equation, and the result is that you were able to cross the bridge, get a little closer to where you wanted to go, right? Less pain, improved motion, whatever it is, okay? So when you do a certain motion, or when you plug a certain variable in this equation, you can leave the office or leave doing that exercise feeling the same, in which case you can just tweak it. That's it. It's not the end of the world. If it's the same, if it's better, then you keep going. And if it's worse, you just stop and you do the opposite. Just switch things up. Just learn to play with motion and see how it impacts your body, right? So we're going to talk about the third most common mistake that people make in the next video here. I guess that'll be Monday at 12:15. But just get that the three possible responses to anything you do in this world would be same, better, worse. And here's the coolest thing. You learn something from almost everything, from almost any one of those responses. So if you're better, again, keep going. If you're worse, you just stop and you start to learn about what makes you feel worse. The problem with going to some people and doing everything at once is that they're having you do 30 different things in PT. The chiropractors have, you know, cracked your neck, your back, your knee, your this, your that. The massage therapist is doing everything, getting rid of all your knots and your trigger points, and they're throwing 80 different variables into this equation, and then you're like, oh, well, I felt pretty good. Well, you don't really know what it was that made you feel good, because they did like 20 things to you, right? So, or, oh, I feel worse. Well, then, like, you don't really know what made you worse. Was it that one thing, or did that exercise counteract that one, or what was it, right? So at the end of the day, you might be like a raving fan of whoever helped you, which is awesome. I'm glad you feel better. But you're actually not much further along, because you have no knowledge and understanding of actually what variable, what one or two things really made the most impact for you. And you don't own the hammer. They still do, right? So hopefully that's enough. I'm sure maybe you have some thoughts or comments if you're watching this and you've dealt with any type of pain or problem in life. Again, it could be weight loss. It could be, I don't know, trying to change your mindset, whatever, okay? Or you're just in pain, right? You're trying to get back to normal. We're going to talk about, again, the third most common mistake that people make when it comes to, like trying to find natural relief or get to the other side of the bridge, if you will. So we're still trying to solve this equation. We're going to talk about the final thing that keeps us from doing that. So again, if you've been down this road and it makes sense to you, please just comment yes, or I've been there, done that. Whatever it is, comment below. I'll use and I'll feed some energy off of those comments and create other like videos for you. So whatever you want to learn, comment below. See everyone Monday at 12:15. Hope everyone has an awesome weekend. Take care.